Hello, I'm John Cuckler, a retired orthopedic surgeon living here in Naples, Florida. My wife and I have 3 children, 8 grandchildren. Margie and I have traveled all over the world. We love to bike. We love pickleball. I love to fly fish. Yes, I tie my own flies. It's something a surgeon can do to feel like he's still a surgeon. We live life to the fullest. We both enjoy good wine and good food. I suppose that shows. I had the pleasure of treating patients for more than 35 years. My career was always involved in the innovation and development of spine implants and knee replacements. I was fortunate enough to be awarded multiple patents for those designs. So I have a huge love for design, innovation, and technology in surgery. And now I'm on the receiving end of that. 4 or 5 years ago, I noticed a very subtle onset of weakness in my legs. It was so subtle and gradual until I got to the point where I couldn't walk more than 10 minutes without stubbing my toe. I developed a foot drop in both legs. But what I mostly noticed was the inability to walk our dog with my wife.
He's not one to complain, and he's not one to admit that there's something wrong. I could just see a general decline in his desire to get up and go do things. This is really different. This is not the same guy. He withdrew into himself, and that took him away from not only me, but from his family.
So that led me to get an x-ray of my spine, and there was the answer, spondylolisthesis at L4-5. And I call my son, who as a distributor of Alphatec products, I knew was very involved in current technology and techniques in spine surgery.
He could have called anybody in the business to get advice, and he turned to his son. And it's kind of ironic how life is. Life is ironic.
Sure, I had raised him and nursed him through a number of injuries, some quite significant, and now the tables are turned, and here I am, the old man, and he's the young buck with state-of-the-art knowledge.
Obviously, as his son, I want my dad to have the least amount of anesthesia. I want him to get in and out of surgery, efficiently, safely, and so PTP is the clear winner. Classic spondy at 4-5, stuff that we deal with day in and day out. So as soon as I saw that, I knew, okay, we've got an option for this. There was no doubt in my mind, once we knew he was a candidate, that this was the right path for him.
Surgery is for patients, not for doctors. And that's, the mantra he lived by. And when you're used to being the one helping other people, it's often difficult, to ask for help or to admit that you're no longer who you once were.
The one thing he did ask me, he made me sell him on the procedure and on the approach.
I knew that there was a much less invasive technique than I used as a spine surgeon many years ago.
I talked to him about SafeOp. We traverse the psoas and know where the plexus is within the psoas so we can adequately and safely have a corridor we can work through to place a cage. So once we went through all the technology related to SafeOp, he knew that this is going to be safe, and he wanted to go ahead with it.
And so in speaking with John, we said, okay, who's the best guy to do this?
John says, wait, there's a guy in Naples, Dr. Benjamin Diddy, who does more of these procedures than really anyone in the United States. I said, perfect.
After reviewing Dr. Cuckler's MRI and examining him, it was obvious that his problem was due to an L4-5 spondylolisthesis. It was causing spinal stenosis when he was upright and especially when he was bending forward, when one vertebrae shifts relative to another. And oftentimes that results in compression of the nerves in the spinal canal or in the foramina where the nerves exit the spine. The operation I performed on Dr. Cuckler was an L4-5 PTP. Placement of the interbody cage resulted in about 50% reduction of the spondylolisthesis, and we were able to achieve the remainder of the reduction with the Invictus minimally invasive pedicle screws. Although SafeOp assured me that his femoral nerve was healthy, it was a tremendous relief when I saw him the next day and he had no thigh pain and strong quad.
I think he threw away the walker, the day after he came home. Just started walking around and moving around, but he was pain-free in his legs. And that's the good news. I had my husband back.
The difference in spine surgery technique between now and 30 years ago is really overwhelming to me as a surgeon and a patient. Minimally invasive, small incision, insignificant blood loss, quick rehabilitation in terms of getting up, getting out of bed, and then out of the hospital. Time does take its toll, but no, I think I'm back to baseline. Really excellent function.
Got them both.
So now he's not thinking about pain. He can be active with the grandkids and go out and do the stuff he wants to do. As the son, you want to see your dad enjoy life. And now he's back to enjoying life.